Pharynx. What is pharynx? It is a funnel shape. It is a funnel shape muscular organ which extends from the base of the skull to the lower border of C6 vertebra. It is a funnel shaped muscular organ which extends from the base of the skull to the lower border of C6 vertebra or lower border of cricoid cartilage. Both are at same level. So, superiorly, it is related to the base of the skull. Inferiorly, it continues as esophagus. Anteriorly, the pharynx communicates with the nasal cavity, oral cavity, and larynx. Posteriorly, it is related to the muscles present here, that is in front of the vertebra, that is paravertebral muscles and the fascia covering it. Subdivisions of pharynx. The pharynx is divided into nasal pharynx, oropharynx, and laryngopharynx. Nasopharynx. It extends from the base of the skull to the lower border of soft palate or the lower end of the soft palate. Anteriorly, it communicates with the nasal cavity. Inferiorly, it communicates with the oropharynx through pharyngeal isthmus. This gap is known as pharyngeal isthmus. Laterally, there is an opening here. Okay, opening for auditory tube. So, the opening for auditory tube is present in the lateral wall of the pharynx, nasopharynx. It connects the nasopharynx with the middle ear cavity. On the posterior superior part of the nasopharynx, posterior superior part of the nasopharynx, there is a collection of lymphatic tissue known as pharyngeal tonsil. Oropharynx. Oropharynx extends from the lower end of the soft palate to the upper end of the epiglottis. This is the epiglottis, upper end of the epiglottis. Anteriorly, it communicates with the oral cavity through oropharyngeal isthmus. This gap is known as oropharyngeal isthmus. Inferiorly, it communicates with the laryngopharynx. In the lateral wall of the oropharynx, near its anterior end, near the anterior part of the lateral wall, there is a collection of lymphatic tissue. Okay. Known as palatine tonsil. Palatine tonsil. So it is present in the anterior part of the oropharynx in the lateral wall. Okay. Laryngopharynx. It extends from the upper end of the epiglottis to the lower border of C6 vertebra or the lower border of cricoid cartilage. Anteriorly, it communicates with, this is the inlet of larynx. So anteriorly, it communicates with the inlet of the larynx. Below, it continues as esophagus. So these are the subdivisions of pharynx. Number 3, muscles of pharynx. It consists of, number 1, 3 constrictor muscles, superior, middle and inferior constrictor muscles. Number 2, stylopharyngeus. Number 3, palatopharyngeus. Number 4, salpingopharyngeus. These are muscles. The interior of the pharynx is lined by the mucous membrane. It consists of stratified squamous, non-keratinized epithelium. Blood supply, ascending pharyngeal artery and tonsillar branch of facial artery. These are the blood vessels which supplies the pharynx. Venous drainage. Pharyngeal venous plexus drains the venous drainage from the pharynx. Nerve supply. You have sensory and motor. Sensory means supplying the mucous membrane of the pharynx. Motor means supplying the muscles of the pharynx. Sensory, it is by glossopharyngeal nerve, that is the 9th cranial nerve, and the vagus nerve, 10th cranial nerve. Motor, that is supplying the muscles of the pharynx. The muscles of the pharynx are supplied by cranial part of accessory nerve, that is the 11th cranial nerve, except stylopharyngeus muscle, which is supplied by the ninth cranial nerve, that is the glossopharyngeal nerve.